You're listening to the Lung Lab podcast, made possible by the Open Source Imaging Consortium. Here's your host, Elizabeth Estes.
So in this episode, we speak with the president of the European Society of Thoracic Imaging for 2026, Dr. Helmut Prosch, who has been a supporter and a person who has been really believed in the concept of OSIC from the very beginning. He's based in Vienna, and he's a wonderful guy and a brilliant radiologist. So here you go. So I'm with Dr. Helmut Prosch from Medical University of Vienna and a very early member of the Open Source Imaging Consortium. Helmut, thanks for being here. Appreciate it so much.
Thank you so much for having me. It's a great pleasure.
So let's talk a little bit about your role at the Medical University of Vienna. So head of thoracic
Imaging? Yes, and I'm responsible there for everything related to chest. So be it clinical meetings with the thoracic surgeons, with the pulmonologists, rheumatologists, but also then for education in this field and research.
Yeah, and it's interesting to me because you have so many multidisciplinary teams that you work with from a radiology perspective. And I think as a patient and as someone who came into this space not understanding the role that you play, it's a super important, almost big cog in the wheel for all diseases. Although, and with you spend most of your time in the thoracic imaging, right?
Yeah, so these teams, the multidisciplinary teams, are the cornerstone now of diagnostics and decision making, because we sit together, discuss the cases from all different aspects and angles, and then come to a decision when it comes to diagnosis as well as to treatment.
So it's interesting because OSIC was started to find biomarkers for disease, right? Can we find earlier diagnosis, prognosis, and response to therapy for those living with fibrosing lung diseases? It would seem that most radiologists would say, we don't need AI because I have my eyes, but you are someone that has embraced artificial intelligence in this space for a long time. Can you talk about that?
Yeah, because I felt that there's a big necessity for improvements in diagnostics and also for predictive biomarkers. Diagnostics, because we know that there's a substantial interobserver variability when it comes to the diagnosis of these diseases. And to help radiologists, we need support. So there's not that many radiologists dedicated to this field. So that's why we need help, because people all over the world need good diagnoses. And that's why I feel that AI has a place and will have an even bigger place in the future. And then it goes beyond that as well, because with our visual description and interpretation of images, we are stuck at some point. And with AI, we will be able and are already able to a certain point to identify new features which help us to better classify diseases, better subdivide these diseases into different groups, and then also tailor diagnosis and treatment. So that's where I feel that AI has its great potential.
Yeah, it's interesting because the human eye, and even a trained human eye, can only see so much, where machines are really good at seeing patterns.
Yeah.
So they can try to find these patterns that the human eye can't see. And you and I talked a long time ago about trying to level the playing field, right? Because a lot of places around the world who aren't near an academic medical center, they don't have a specialist in thoracic radiology.
Exactly.
So they aren't even sure, maybe they saw interstitial lung disease once in their classes, but they aren't even sure what they're looking for, and the machines can help level those playing fields.
Exactly, and there are so many of these diseases, and you can't expect every radiologist don't know every disease. There's, first of all, so many, and most of them are very rare. So if you see these diseases just once a week, once a month, you will never have the experience to do a very sophisticated diagnosis. So that's where these diagnostic tools come into play.
So people who are living with disease or their caregivers might say, well, great, machines are here, AI's here, why haven't we done this already? So what is the holdup? And I ask you this hypothetically because being with OSIC for the last 8 years, I know part of it is getting the data into a form that can be used. Can you talk a little bit about what we need, or if you had a magic wand and you could make it so, what do we need to speed this up, to be able to diagnose it sooner and then to be able to find other characteristics and see other rare diseases or prognosis?
That's exactly where OSIC is. What we need, and we had this in the first, when we started the discussion whether or not to build up OSIC, we need data. and we need the heterogeneity of data. We want to have a tool at our fingertips which can be used not only in academic centers in Europe or in the US, but also in Asia, in Africa, and anywhere in the world. And for that you need a heterogeneity in patients, heterogeneity in machines, in protocols, and so forth. And no one is able to do that by himself. This is why we need collaboration. And you know what the beautiful thing is? In this field, in interstitial lung diseases, this is such a big group of friends. Even if we are competing on a scientific level, we are able to, and we proved it's possible to share data and to share also our enthusiasm to bring this field forward.
Yeah, it's interesting you say that. And I said, we get into this disease state, I don't know anybody, and then within a very short amount of time, you feel the passion and you feel the people who are collaborating. There was a conversation yesterday in a session we were in about standards for radiology. Now, I know that you are currently the president of the ESTI, the European Society for Thoracic Imaging. Congratulations on that. A big conference next year in Salzburg, which will be lovely. But there was some conversation about if we want AI to get better and to work quicker, we need to have standardization as it relates to radiology imaging, right? But at the same time, we made a decision with OSIC that we wanted real-world data, right? So the algorithms can't just work on pristine. They need to work on things that are from all over the world in all different forms and factors. I suggested that there's a continuum. And on the left-hand side, we have, really rough, all crazy. On the right-hand side, we have complete standards and nothing is accepted without it. And I felt like somewhere we needed to move closer here. What's your take on the standards for radiology, thoracic radiology, as it relates to machine learning? Where do you think we need to go? And what's your take on that?
Yeah, to some degree there is a standardization. So patients are positioned in a standardized way. The inspiration depth is as good as it gets. But I understand the wish of our colleagues from the AI field that the images are acquired in a very standardized fashion. But this wish can't be fulfilled because in my daily life, many patients don't speak our language. In this case, it would be German, but also in the US, I'm sure you have many immigrants who do not understand the technicians in a way that it would allow for standardization that it would be required. Then patients are dyspneics, meaning they can't take a deep breath or hold their breath for such a long time. So standardization is something which would help us to come up with a very sophisticated algorithm which would work in these specific environments, but for our daily life we need something which is much more robust.
So you said it, some patients can't breathe the way you needed them to breathe. So I mean, it's almost like we've talked about this a lot, but we can't let perfect be the enemy of good. And the machine should be able to make up for some of that, which is what we're seeing. There's conversations now about generative AI taking lower dose CTs and upcycling them to higher dose CTs to be able to look and see better. So in theory, we should be able to do that. And I understand the frustration of the machine learners who want this, because in other fields, let's say self-driving cars, the roads don't change. Yeah. They're the roads of the roads of the roads, right? But when you're talking about a patient who has a very serious disease, who can't take a breath, there's nothing we can do about that. We have to do the best we can with what we're given. So I appreciate that answer. Where do you think, if you had a crystal ball and you're looking forward, and ESTI is going to be a big moment, right, and a big conference where a lot of you get together to talk about where we're going, I guess I'd ask you to look backwards and then look forward. So if you were to look back, do you think that we've made enough progress in the last, I'm going to use 8 years that OSIC's been in existence, but the last decade? And then where do you think it's going in the next decade? I mean, what do you see and what do you hope to see?
Yes. As a researcher, you can never be happy. Because you want to improve, you want to move forward. So once you're satisfied, you're lost. Because this is not there, then there is no motivation to move ahead. So there has been a lot of success, and we should be proud of that. But there is so much more to do, and what I see, OSIC is just what you and the team here, what you achieved is just fantastic. And there's nothing comparable, at least in what I see, there's nothing comparable to this initiative. And we are able to not only to bring data together, what I feel is even more important is to bring people together. So in our meetings, we have companies, we have scientists from universities. They get to know each other, they get to know the ideas and concepts of others. And this is the even, for me, equally important. It's not just the data, it's just also the networking amongst scientists.
Yeah, I feel like we've talked about this, but I feel like OSIC was put together, this is bold of an American to reference the Italian Renaissance, but since you were born in South Tyrol and raised in South Tyrol, I'm going to go there. But, OSIC was put together to bring people from orthogonally related industries and disease states and verticals together to try to actually do something different and see it different. And they say the Italian Renaissance was the same way. Right now, there are good and bad things, but you had the bankers sitting next to the goldsmiths, sitting next to the sculptors, and they all learned and co-created together. And that's what OSIC is meant to be, and that's what we hope to do. And then looking forward for you, for the field, it's what do we need to do and where will we be? Where will we be a decade from now?
My vision, what we should do is we should get closer to the scientific societies, to open it up to them as well. We are open already, but some don't know about it, And we with this new platform we are having, we can open it and make it more accessible to also the smaller groups and to research collaborations. This would make it much more worthwhile. So our goal was never to achieve to gain money. We want to gain knowledge and scientific improvements. And so this is where I would see it, to move closer to this, even closer to the scientific field, not just the specialists where we are right now, but open it up and make it more accessible to more people. This is where I see this is, as the name implies, open source. Yeah. We need to improve on that as well.
Let me back up really quickly about the disease states. When we started OSIC, we started with pulmonary fibrosis or idiopathic pulmonary fibrosis, right? No known cause. We don't know what causes it. We don't know their progression. We don't know, the disease state and where it's going to go. We've amassed a lot of data in that space. We've amassed a lot of data. Now we're bringing in bronchiectasis and sarcoidosis and alpha-1, right, to try to help move these forward. And we're partnering with interesting patient groups in that way, and we're really proud of that. Let's talk quickly about the very beginning. So there's been a lot of topic of conversation, and as you know, OSIC has a lot of data in the ILA space. So interstitial lung abnormalities, the bane of physicians' existence, right? When you tell a physician, I saw something, it's what we call an interstitial lung abnormality. We have no idea what it is, because right now there's no way to characterize it. Do you see a day when data could be characterized with the machine learning to be able to say that ILA should go into this bucket of disease, this bucket of the disease, so we can actually back up the diagnosis and put people in the right categories of care? Do you think that we can get there using machine learning?
I don't think so. I'm convinced so. This is where we need to go. And with all these screening initiatives worldwide, the amount of ILAs detected will be immense. And you can't send all patients to a clinician, and you can't make all patients or participants afraid of dying from something they have never heard about. You have to identify the ones who are at risk, and even more so identify the ones who have no risk, because these are the ones we don't want to see again just for this. But this is really something we have to work on, but I'm convinced that here this is the field where AI, but maybe also in combination with some lab findings, all the biomarkers, is then able to pave the way in which direction patients should go.
We keep calling it the canary in the coal mine. We're a reference to, could this thing be the marker that tells us what everything else is? And we see a day where someone goes in, we find out that maybe they have emphysema, or maybe they have something else, but if they have pulmonary fibrosis, we find it 2 years sooner. We get them, we try to do that. Now, people will say to me, then what? Do you put people on drugs? But I also think this could help find perhaps other distribution types of drugs.
And not only that, I think we also will learn more about the course of the disease, the development of the disease, what stops the disease progression, all of these important questions where we don't know much. We see these interstitial lung abnormalities in so many people, but lung fibrosis is not so common. Right. So there is a gap in between, and we need to understand this. And this is where this wealth of data will help us to better understand fibrosis and other interstitial lung diseases.
Well, Dr. Prosch, you have been a supporter from this in the beginning. You have helped move science forward. I think, as you know, OSIC has now been the driver of over 75 published papers, and I know that doesn't seem a lot for the patients. I always say that with a little bit of, so what, right? Where does that go? But I know that we're driving science forward, and I know that our goal, our collective goal, is to go faster and further and help these patients and these caregivers and those living with these rare diseases a better chance to understand their disease progression and their disease trajectory. So you've been at the forefront of that, and I appreciate it.
Thank you so much. And thank you, the whole team, for bringing this forward.
Thanks for listening to the Lung Lab podcast from OSIC. Share this episode of the Lung Lab and subscribe to the show wherever you get your podcasts. The Lung Lab podcast is produced by Bloodstream Media. Learn more at www.bloodstreammedia.com.